Welcome, everybody. My name is Andra Lichtenstein. I'm the chair of the Ashby Village Board, and I also serve on the board of directors of Village Movement California. So we're excited to be chosen as one of two villages for this pilot program between Village Movement California and myNurse. Ashby Village, some of you may know, is the co-founder of Village Movement California, and they're our trusted partner. So you can be confident that the programs that Village Movement California brings to us, to our members and volunteers, are going to be excellent programs. So thank you, Village Movement California, and thank you to Roberta Pressman and our member support team for bringing this opportunity to us. And now I'd like to turn it over to Charlotte Dixon, who is the Executive Director of Village Movement California. Thanks.
Great. Hi, everyone. And thank you for joining. We're very excited to bring our partnership with myNurse.ai to Ashby Village. We started in San Luis Obispo and we're moving up north. And so I'm going to shortly turn this over to our team at myNurse.ai. I want to first just give you just a couple of logistics, which is that your microphones are muted so that everyone can hear clearly. The webinar is being recorded and we'll send it to you and we'll post it on the Village Movement California website and the Ashby Village website. So this will be available to you after the workshop ends. We are going to focus today on the services that myNurse provides. We're not going to be talking about specific health concerns. We value your privacy, so we ask you not to share the details of your health conditions. You can do that later with a myNurse team member. They strictly adhere to HIPAA and all health privacy guidelines. And then finally, we encourage you to ask questions through the question function at the bottom of your screen. If you have an iPad, that icon may be at the top, but it's the Q&A icon. And please type your questions in as they occur to you. And Jessica, who is our main presenter, will incorporate the answers to those questions into her presentation, and then we'll also have time at the end for you to ask your questions. So with that, I want to turn it over to the myNurse team.
Thank you, Charlotte. Thank you, Andra. Hello, everybody. My name is Waleed Mohsen. I'm co-founder and CEO of myNurse. And typically when people ask me about myNurse, it's older adults with chronic conditions like hypertension, diabetes, who are frustrated with the inconvenience of going for a doctor's visit and only getting 15 minutes to talk with them, receiving confusing care plans and medications to keep track of, specialists like cardiologists and nephrologists who don't know what their other doctors are telling them. You know, the right hand isn't talking to the left hand. And for me, this started a few years ago when I started looking into my own health and learned chronic conditions run in my family, and was likely why both of my grandfathers died of heart attacks at a young age. And the notion of that scared me, that was something that could happen to me. And so I started myNurse to support the services that could have benefited my own grandfathers, so their experience would not be anyone else's again. And to help with this, we've developed a program that is a covered benefit for Medicare beneficiaries that collaborates with your existing doctors. Our members work with a dedicated wellness coach who take the burden off of your shoulders to facilitate communication between your doctors, provide ongoing support for your care plan and medication questions. And many of our members receive vitals devices paid by Medicare to track your health progress that you keep with you at home. Because it's great to be able to measure your progress and share that information with your doctors, and we help with all of that. And now with this collaboration with the Village Movement California and Ashby Village, we'll be able to deliver a new standard of care by leveraging the resources of the villages to make sure members have access to everything they need to live their healthiest lives. To tell you more about our program, I'm going to turn it over to Jessa, a registered nurse and our Director of Program Strategy. Jessa?
Thanks, Waleed. Go ahead and share my screen here. And you guys see my slideshow? Waleed?
Yes.
Yeah, great. So thanks again for the intro, Waleed, and really happy to be here. My name is Jessa Alt, and I'm a registered nurse. I've been working in healthcare for over 14 years, really dedicating my career to helping solve complex care management. I understand what it's like to be a patient myself, someone with multiple chronic conditions and being shuffled between multiple providers, dealing with insurance, and left to kind of manage things on my own. So I joined Waleed and our clinical team to really design a program that will help you navigate not only the medical aspects, but the behavioral and all the other pieces to healthcare that matter. So whether that's talking to your family about your condition or creating habits that will actually lead to impactful change. We're here to help you between your visits, and we're here to provide an extra layer of support and accountability. I want to start with just giving you an intro to what we're here, what's the problem we're looking to solve. And I would love to hear from you guys if you've experienced this, if this sounds familiar, and hopefully you see the value that we are hoping to solve. And we're really here again to create an experience that is taking away the burden of this complex journey in healthcare. So I'm going to talk about what's in it for you. This next slide is just about healthcare is complicated, right? How many of you have been given a referral? Something as simple as please go find a cardiologist. That simple task can be really frustrating and extremely time burdensome and impossible for some people who don't have, say, transportation to get to that new provider or an understanding of how to get that referral, or the provider may not have appointments for months. Something that simple, let alone getting durable medical equipment or asking for assistance for behavioral health. It's getting more and more complex. So we understand how complicated healthcare as a whole is and how poor that experience really can be. So again, we're here to design something that is better than the current standard. I also understand that managing healthcare conditions can be challenging, especially when we talk about something called chronic conditions. Now, a chronic condition is a condition that lasts over 12 months. So if you think about that, conditions like diabetes, hypertension, I'll give you some more examples in a moment, but these conditions tend to be lifelong once you develop them, and you're left kind of on your own, figuring out, what do I do next? And according to the National Council on Aging, about 80% of older adults have at least one chronic condition, and 68% have at least two. That's a lot of us. And it's no surprise that providers don't have the time or resources to help people who are actually at home managing these conditions. So myNurse, again, is here to help with that. Some examples of when I mention a chronic condition include, but are not limited to these. So if you think about diabetes, that's type 1 and 2. Congestive heart failure, you may hear an acronym of CHF. Asthma, lung conditions such as chronic obstructive pulmonary disease, behavioral health conditions, major depressive disorders, chronic kidney disease, cancer, high blood pressure. These are all conditions that folks are dealing with, managing typically with medications on a daily basis, or they have some sort of treatment plan that they're following, or may have multiple specialists. So these are examples of conditions that would qualify you to be part of the myNurse program. I'm going to pause here. I see a few things in the chat. Any questions so far, Charlotte?
No. The chat is mostly the panelists chatting with each other.
Oh, okay, great.
We're good. Thank you.
Okay, not sure if I can actually hide that. Okay, great. Let's see, I seem to have lost control of slides. There we go. Sorry, guys. So obviously, this is very frustrating if you have a chronic condition. What I want to highlight here is that we understand how frustrating this is. And with our program, you will get the added benefit of not having to go to an appointment. So we're hoping to add a layer to keep you at home, keep your providers in the loop so that you're not having to go to as many follow-up visits. You're not having to do a phone tree and press 1 and deal with 1-800 numbers. You get a one-on-one nurse that you can call directly. And again, we're here to add a layer of support so that we actually communicate on your behalf with your provider, often through a back line that we have. So if you need an appointment sooner, we can help with that. We can make sure that you understand exactly the costs for our program and get you the support that you need on your next phone call. And really, why is this really important? Doctors don't have the time. They also don't have the staffing right now. I don't know how many of you have had an hour with your doctor or even have had an office where there is a registered nurse there to talk you through your care plan. I haven't myself. This is a gap that we have found, and part of our founding reason is that we feel that we can add a value for our providers and our patients by adding that additional staff. So if you think of us kind of an extra team behind your provider here to help you manage your conditions, that gives you at minimum 20 extra minutes with a clinician each month on top of the time that you have with your doctor. So what's included with myNurse? If you were to join us today, you would receive an initial nurse practitioner visit. That's one of our staff that we would set you up with on a video visit. Again, that's included in the program. And the point of that visit is to really understand your care plan from your provider. What's your current treatment plan looking like? What are your current concerns? What kind of medications are you on? And we create a custom care plan with your doctor so that we're not replacing care with your doctor, we're actually supplementing it. And then you'll be assigned to one of our clinicians on our team. We have registered nurses, LVNs and MAs, and dietitians, diabetic educators, who you'll actually be paired with so that you have one person, one point of contact, one phone number that you call on a regular basis, and we also call you. So it's not reactive only, it's not when you're sick. You're actually getting someone checking in on you. Waleed mentioned devices. I'll talk a bit more about that in a minute. But if you have a condition like high blood pressure, we actually send you a device that will monitor your blood pressure straight from your house and send that data directly to us. And then we share that information with your doctor. So it gives the more data that we get, the better that we can help make little tweaks. It may be with your diet. It may be talking to your doctor about changing meds if necessary. But that's really important part of managing your health is understanding the day-to-day patterns. So we do send a device straight to your home. And then we work on the backside with your provider. That might be your cardiologist, it may be your oncologist, your primary care doctor. And we're kind of bridging all of those folks together on a single care plan so that everybody is connected. We all understand the goalpost of where you're wanting to get to, what are your current barriers. And if you need to get in sooner with somebody, we're here to be that ally. We also work closely with the village and also our own community resources to help beyond just the numbers. We know there's more to healthcare than just looking at that 120/80. What is going on beyond that? Are you going through a stressful time in your life, divorce or loss? Are you finding that you are having difficulty getting up and down the stairs? We have a lot of community resources, and we work with the care team at the village to really make sure that you're taken care of beyond just the medical piece. I'm going to talk a bit more about all of that in a second.
Tessa, just quick question. One of the participants asked where you're located and do you have an office?
Great question. So our team is currently located in California. We don't have a physical office. That is one of the wonderful parts about our program is that we do all of our work remote, including this care. So you don't have to come to our office. We call you, you can call us. All of our tools that we'll send to monitor you get sent straight to your home. We can do video calls, phone calls, texts, or email to help support you in making sure that you know exactly how to use your device and talk you through what's needed. But there's no need for you to come to us or vice versa. It's really supported virtually. Any other questions before I move on?
No, there aren't any at this time.
Okay, great. So one of the things that our nurses and care teams do that I think is really important is taking that time to explain your care plan. And you might wonder, what is a care plan? It can be something as simple as a doctor telling you, okay, I want you to follow a DASH diet for your high blood pressure. And you're left with, what the heck is DASH? I don't even know. I didn't know that I had hypertension. I thought I just had a high reading in the office. We will take that and really talk you through what that means. So a DASH diet, for example, is following a specific diet for high blood pressure, and we'll give you resources. We can send that in the mail. We can send it in email. We can send you videos, and then we'll do Teach Pack to make sure that you understand what the instructions were. And some of that may be involving setting a goal so that in the next week, maybe you incorporate one piece of that diet, and we'll check on that progress. So a big part of this program is teaching, education, and following up from what your doctor may have sent you home with, maybe a piece of paper, and you're left wondering what that means. We're here to be that added layer of educational support. We also want to make sure that you understand how to take your meds, but not only how to take your meds, what are the medications for? What are some common side effects? Are you feeling okay taking these meds? Can you afford them? We had one member who actually was prescribed a medication that wasn't on what we call the formulary, so it wasn't covered by their insurance. And there was another option that was. So when we saw their blood sugar spike on our dashboard, we called them immediately and said, can you tell me what's going on at home? What caused your blood sugar to spike this morning? They said, well, I couldn't afford my medication. So we called the doctor's office immediately and got them switched to a medication that was covered. And we saw, obviously, the blood glucose come down. So we work not only with you on the education side, but to make sure that you understand how to take it, when to take it, side effects. We can talk about financial burden related to meds, get you some resources if needed, home delivery of your medications, and review that on our calls with you. We also make sure that, again, when I mentioned the referral example, that can be a real nightmare. But we're here to be that care coordination with you, an ally, an advocate. Make sure that you're not waiting 6 months or that referral didn't get dropped. So we're a whole team of folks here ready to support you for that referral, whether that's a durable medical equipment referral, behavioral health, or something related to grief or loss support. And so again, we're really excited to work with Ashby Village because you guys already have a wealth of knowledge and community-based resources, and we'll work with you to make sure that you get what you need in the community. Some examples are, access to healthy foods, resources in the community for elder care or respite, help with grief or loss. I mentioned a few times, a lot of community support groups, or something as simple as I don't have transportation to my appointment, or I can't get there alone given a vision impairment. We can help with all of these things. So I mentioned we're here to help with habits. Really a core component of the program is building on what we call tiny habits. So we use things like, it sounds fancy, but it's called motivational interviewing. So understanding what's important to you. What are your motivating factors? What are your barriers? What are your goals? Kinds of things would make an impact to you. Is it that you want to change your diet for benefiting your condition, or you have a long-term goal of attending your granddaughter's graduation and you want to make sure that you are on top of your fitness and healthcare eating habits so that you can fit in a certain dress? It doesn't have to be just focused on the numbers. But we will work with you on your calls to create goals and building slowly. So each of these goals is going to be attainable, and you'll get a little boost of dopamine every time you meet a little bit more of those targets. And we'll talk you through, if you don't meet your goal, that's okay. We're an accountability partner, but we're also coaching. So we're here to say what went right, what went wrong, and how can we help get you to that next level. I want to mention that I talk a bit about us being this layer between doctors. We are not a replacement for your doctor. We work with your provider. So a big piece of being part of our program is that you actually have a primary care provider that you have, and that you're willing to have us work with. We don't want to be stepping on toes. We're here to help supplement. So if you have a provider that you are working with, we will call them, we'll get a care plan and your specific targets, and call on your behalf if there's ever a concern, or if you need an appointment sooner. We work very closely with our providers and our members' providers to make sure that they get the care they need.
Jessica, there was a question. Let's do this one first, and then I'll ask you the question about referrals.
Perfect.
Okay.
So qualify. How do I know if I qualify? So if yes to all of these, you will qualify. So the big thing here is that you have to be on Medicare fee-for-service, and that's what we call original Medicare. So that is an absolute must. We are reimbursed by Medicare, so you can't be on Kaiser or an HMO plan. So you must be on Medicare fee-for-service. If yes to that, if you have 2 or more of those chronic conditions, and again, that list isn't limited. If you ever have a question, you can talk to us, and we're happy to review what you may have. Most folks have more than one chronic condition that qualifies, so please don't feel that limited list is just the only ones that will enroll you with. You must have a primary care provider that we can work with, and give us consent to work with them, and be willing, if you have a condition such as, let's say, high blood pressure, high blood sugar, if you're in our program for remote monitoring, meaning we're sending you a device, you have to be willing to collect at least 16 days in a month worth of data. So at least every other day, taking a measurement. For some folks, that might sound like a lot, but again, you'll be given a coach who can talk you through how to get this incorporated in a schedule that doesn't sound so burdensome. And we also require a 20-minute call, video, or email exchange a month. And that's to make sure that it's a requirement for Medicare, but it's also to make sure that we're able to review those data points with you, provide that support, and coordinate any care that's necessary. Charlotte, was there a question that I can help with?
Yeah, there was a question about the referrals, and let me go to that specifically. What is your vetting process for for referrals? Are you able to refer people to specific medical systems, for example, Sutter, Stanford, etc.?
So we don't necessarily refer to anybody in specific. We don't do what we call steerage, where we're partnering only with, like Stanford, for example. We would rely on you and your provider to say, I'm interested in a referral to blank, and if you're hitting roadblocks, we're here to help. But certainly we have a large library of community resources where we can provide referrals, for example, to behavioral health specialists in your area that specialize. Let's say you're looking for a therapist that specializes in anxiety or PTSD that takes your insurance. We can help with providing you that list, but we wouldn't refer you to a specific system. That would be something that you would be able to choose yourself if covered by your insurance. Did that help answer the question, Charlotte?
So, I mean, what I'm hearing is that your doctor, your primary care doctor, will refer you to a specialist, and myNurse is there in the background to help make that referral happen, or to follow up, coordinate, to be there as an extra layer of support.
Correct.
That's what I'm hearing.
Correct.
So here's another question. Here's another question. What do you do with the biometric data you collect? And what are your privacy policies and practices?
Great question. So we follow all, as Charlotte mentioned early in the call, we follow HIPAA laws, and we've manage all of the data in a secure manner. So the data that is collected is transmitted directly into our system, which is secure, and it's tied directly to your chart. So nobody else is having access to your data. When you sign up, you will also have the ability to read our terms and conditions and privacy terms, that you have the option of saying, yes, I agree to this or not. But certainly we follow national HIPAA laws and make sure that the data is securely transferred to our system and doesn't leave that. In regards to coordinating with your doctor, part of this program is to make sure that your doctor is aware of your trends of your biometric data. If you're on the program where we are helping to monitor your blood pressure, we would, with your permission, as part of the program, share that summary with your provider on, say, a monthly basis. Or if you have a day where your blood pressure is spiking, let's say suddenly it's 160 over 90, and that's out of range for you, and you may or may not be experiencing symptoms, we would work with you to call your provider on your behalf and make sure that we're routing you to the right care at the right time. So whether that's going into the provider's office or going to an urgent or emergent care.
Great. Now, there are some other questions, and what I'm wondering is, it's almost like the Q&A session, and people have excellent questions. Do you want to go through your slides, or should we stop for a little bit and go through the questions? What do you want to do, Jessa?
Yeah, let's go through this a little bit if folks are okay. And make sure I take time to answer the questions.
Okay.
Hopefully we cover along the way. Does that sound okay?
Okay, that sounds great.
If there's anything, Charlotte, that because I can't see the questions, sorry about that. That seems relevant, something on the slide, feel free to interrupt.
Right, that sounds great.
Great. So again, this is voluntary. There's no mandatory enrollment here. We're offering this as a benefit for Ashby Village members, and it is covered by Medicare. You may opt out or in at any time. There's no open enrollment or set amount of time that you have to be in the program. Most of our members are engaged for months, if not years. We have some members who are in the program for a few years. And one thing I want to call out is this is really important for me as our program manager, and that 93% of our members rated the program as very good or excellent. So those who are in the program are very satisfied. And we do this as a survey that's sent out on a quarterly basis. And folks are finding value. So that's really important for us as a company. Just want to take a minute again to highlight some of the conditions. If you have a condition that isn't listed here, I just want to make sure there's an understanding that that doesn't mean that you don't qualify. There's a lot of chronic conditions, a lot of neurologic conditions that I don't have listed, MS, ALS, cognitive conditions such as Alzheimer's or memory problems. The only caveat with if you have yourself or a family member with a condition like Alzheimer's is that we have somebody in your home that's able to communicate in their behalf so that there's an understanding of the care plan and that we can really help the individual. But in general, if you have a question about whether or not your condition qualifies, I'll give a phone number at the end that you're welcome to call and speak to one of our representatives. So one of the pieces, so we talk about remote patient monitoring and chronic care management. I just want to highlight what those two things mean here. So chronic care management is really this nursing service that is regardless of if you have a monitor. And I'd like to tell you a little bit about an example of a patient named Eleanor, and she has three conditions, right? So she's got high blood pressure, cancer, and depression. What would that look like at myNurse? So Eleanor would have her initial visit with a nurse practitioner who's going to review all of her notes from her provider. We're also going to reach out to her oncologist so we understand what treatments she's on, how frequently she's getting infusions, what kind of medications she's taking and side effects she may be experiencing. How often is she supposed to check her blood pressure from her provider's perspective? What's that range that we want to see her in? What's normal for her? And what has she been doing to cope with her depression? In her calls, she shared that she recently had a loss of a spouse. So we're going to review not only her blood pressure, talking through how to manage that with diet and medications and monitoring. So getting that 16 data points in a month. We're going to talk about her cancer care. Does she have support at home? Does she have transportation to her infusions? Is she able to afford her care? Does she have a wig? Does she have somebody who's able to care for her before and after treatments? And then on the depression side, that may be getting a referral to a therapist or a support group in the community and making sure that her family is working with her on her care plans and talking about some things that might be a little difficult and oftentimes providers don't have time for, things like advance directives, living wills, and making sure that she understands what her actual care plan is looking like. So that's an example of someone with multiple conditions. They will receive a 20-minute phone call outreach a month. They can also call us at any time, and we coordinate on a monthly basis with their providers. Okay, so again, what's a typical coaching call look like? You'll have at least one call a month that's scheduled. It's about 20 minutes. This can be a phone call. We prefer phone or video call. Email is acceptable, a text, we go with what works for you. But it must be 20 minutes a month for us to be able to bill Medicare. We schedule it when it works for you. You can say as specific as Thursdays at 9 a.m. or I never want to be called Monday mornings. We review what your needs are. We'll talk about your barriers, whether that's financial or family dynamics or just inability to get time or motivation. And we'll talk about getting that goal in place and starting small and being that accountability partner with you. We'll talk about your condition in depth. If you have something that you're recently diagnosed with, we'll take the time to make sure that you understand what that means. What are the next steps? What kind of appointments do you need? And how are you going to get there? And we'll work with your support team. If you have a family member that you want to have part of the calls, we can actually three-way them in. We can email, but certainly would not do that without your permission. So that's an opt-in. So chronic care management, this is just a definition from CMS. It's coordination, basically home and care coordination. So we mentioned about this already, making sure that you're feeling that you're connected with both your provider and with providers in the community, not just your one healthcare provider. I'm going to move into remote patient monitoring. Charlotte, are there any questions related to coaching so far before I move into remote patient monitoring?
No.
Great. So the fun acronym for this, RPM, you might hear this thrown out. That means remote patient monitoring. And that's basically a way for us to gather data and understand how your health is doing on a day-to-day basis. So we collect, and let's say it's a blood pressure monitor. You put the cuff on your arm, press start. It'll automatically send to our electronic health record, again, in a secure way, so that your coach can see at noon today, you were at this point, and in the evening, you were at this point. And if we're seeing big changes, we can have a meaningful discussion about what may have happened between those times. That may be that you ran a mile, it may be that you had coffee or you missed your meds. But these are insights that your provider typically doesn't have. And we can take the time to discuss what might help to bring those numbers back to where they need to be. So again, remote patient monitoring is a way for us to collect data to provide more insight into your progress of your healthcare condition management. And so you get a device if you're in this program. It's included. We deliver it right to your door. We have the ability to do a video call, just like how you can see me right now. We'll talk you through The setup is not hard. So for those of you that are worried about tech, please know that we offer the Bluetooth, which means that it would connect via Bluetooth to your phone, or we have a cellular that you just step on the scale, for example, and it'll send right to us. So you don't need to have tech skills in order to have one of these devices. And we will talk you through on your first call with your wellness coach. We'll order the right one for you and talk you through what to expect. And you'll get a box with instructions and a welcome kit in the mail about 3 to 7 days after you enroll. And I think I talked about this, but just as a reminder, we will do outreach as well. If we notice one of your numbers are higher or lower than we would expect, we'll give you a call and say, how are you feeling? Are you having any symptoms? What do you think is that maybe causing the increase in your blood pressure? We'll have you repeat measure usually. Sometimes it can be, your initial measurement may not have been on your arm right, or maybe you're worked up after you had your coffee, for example. So we'll do another measurement and we'll call on your behalf if it's concerning. And, again, as a caveat, we aren't replacing emergency care. So if you are having significant symptoms or you're worried about a heart attack or something like that, please reach out to your provider or EMS. We are not a substitute for that. And our current business hours are California hours between 9 and 6. If you have a question outside of those times, you're always welcome to call or leave a message. But if it is urgent and related to a symptom, we would recommend you contact your provider. So one thing that's really important to know about RPM is that CMS requires 16 unique days of data sent a month. That might sound hard, but that's 4 days a week. And that can be any type of reading. So if you have a scale and a blood pressure cuff, it can be the scale one day, the blood pressure cuff the next day. And we'll work with you to make sure that you have something that's set up in the schedule that works. We also will call you at least once a month for that scheduled call, and we'll review your data. So the take home with RPM is that there is a requirement for about 4 days a week of sending in the data. And that means just putting it on your arm, pressing the button, stepping on the scale. That counts as 2 separate readings. That would count for the 16 days. So how much does this cost? If you have Medicare fee-for-service, it is billed under Part B, so it is covered. The caveat here is that it really depends on your situation. So have you met your deductible? Do you have a supplemental insurance? That will change whether or not your initial cost is a specific amount, but it's usual when standard copays and deductibles would apply to this. If you have quite specific questions about your specific situation, we're happy to get you on the phone with our billing department right away and tell you what to expect. But it does depend on how much you've paid so far in the year, whether or not your supplemental will cover. But it is a covered benefit, and 80% of folks have no additional charge. So if you're interested, here is our phone number to call and enroll. And we'll make sure that Charlotte and the Ashby Village team members have our contact information. We also have a village specific webpage that you can go to for more information. So just as a summary, I'm just going to walk through exactly what we talked about. The first step would be having a nurse practitioner contact you. To do that, initiating visit, understand what is going on with you and your health, what's been working, what's not working, where are the gaps in your care, and how can we be of value. The next part will be sending you that device in the mail if you need it. It'll come via FedEx. You'll get it within 3 to 7 days with some instructions. And then you'll get a call from one of our clinicians. Your wellness coach will reach out to you at whatever time you prefer, and you'll start those 20-minute phone calls. We'll also outreach you if at any time you have a value that's out of range, so that we make sure that we are calling you right away if there's a concern. You also have the option of using our mobile app. So if you have a smartphone, you can track your own measurements and find educational materials and more on our mobile app, but that is not required. It is something that is an add-on if you'd like. So again, here's the website for you to find more information or log in, to find out if you'd like to enroll, or you can give us a call. With that, I'll leave you guys with some question and answer time.
Good, great. So we have a bunch of questions, and they range. So I'm just going to kind of take them from the top, and I think we can stop the slideshow and just have the faces at this point, Lori. Good. So in terms of coverage, does United Healthcare if you're covered by United Healthcare Medicare Advantage PPO, would you be able to be covered?
United Health
Advantage plan, a Medicare Advantage plan, PPO.
I will have to come back on that. I think.
Okay.
I don't think so. Waleed, are you on the call still?
He left the call, but what I'm thinking for the person who asked that question would be to just call myNurse.
Yeah, our enrollment can help you with that. Any questions about insurance? It's really, the main thing is that you have Medicare, just standard fee-for-service Medicare is what qualifies. Certainly any Kaiser HMO plans would not, but we can double check on that one.
Great, okay. If you do not sign up now, can you do so at a later time?
Absolutely. Yep, there's no limit. Same with opting in or out. We're here and we're ready. We're excited to have you guys join at a time that works for you. For some folks, it's, I'm busy, I'm going on vacation. We can also put people on pause if there's a time in your life that's getting hectic. We want to make sure that we're respectful of what's going on, but certainly you may join at any time. We'd be happy to have you.
And is there a limit to how many people can join? And that gets into, are you covering California as a whole? Are you covering nationally? Do you have a presence? What is your service area at this point?
Yeah, no limit. We're a company that is ready for growth, and we are staffed and ready to take on an unlimited amount of folks. We do so in a mindful way. We keep our coaches, to a certain caseload so that they have the time to do the calling that would be necessary to keep this really concierge style of medicine. We are currently in California. We will be expanding throughout the US, but right now we're starting just in California. We're really excited about having, and in terms of if you know folks within your family and your friend circles, we would gladly have anybody that you know come in. They don't have to come in just through the village. They can be a family or friend.
Right. And so the question about, do you provide service in the North Bay, for example, Santa Rosa or Sacramento?
Absolutely. Yep.
Yes. Okay. And one of the things that I wanted to say in relationship to this is Village Movement California, myself and our healthcare team, of which Andra is a member, has spent over a year building a relationship with myNurse. And one of the things that we've been really concerned about and have openly talked about is their capacity to scale, their capacity to meet the demand that our partnership might generate. And we are confident that is the case. And so we're walking hand in hand with myNurse as they scale and expand their program that really aligns with the Village mandate to support older adults staying in charge of their lives in the places they call home. And as we as a movement also expand and scale. So we have spent a lot of time vetting myNurse and making sure that they can meet the demand. And that's part of our agreement, is to make sure we are communicating about that, and that in the end, our Village members are getting services that they expect after hearing about myNurse and signing up. Let's see. What about symptoms? Here's a different question. What about symptoms that are not part of your chronic diagnosis? So you may have something that's not part of the reason that you're in myNurse, the condition that's qualified you, but it is something that concerns you. Can you call myNurse about those?
That's a good question. I would say we're not the typical triage center, right? Where you would call a nurse line if you have a cold. That wouldn't be the same service that we provide here. But if you are on a call with us and you're having difficulty, let's say one of your conditions is causing you some pain, or you're having something as simple or not as simple as back pain, we'll talk about that with you on your call. But we're not meant to be the symptom line if you have a fever or a sore throat. Those would be the types of things that you would want to make sure that you're calling your primary care provider for. But during our calls, if these things are impacting your ability to manage some of your chronic conditions, we've been to the conversation, but a little bit different than a traditional nurse line, if that makes sense.
Great. So there are a bunch of questions about the 20%, the 20% copay, whether the person pays for that, him or herself or themselves, or whether it's covered by the Medigap plan. And so there are questions about how much is that? How much is it? 20% of the total phone call?
Yeah, so I'm happy to send you guys out a billing FAQ after this. I think that's a common question that it gets complicated because it really does depend on your specific supplemental plan and how much deductible and what co-insurance you have. So unfortunately, I'm not able to speak to what your specific cost would be, but we do have a full billing department. If you're interested in joining, we can have you talk and they can run your specific cards and give you that exact amount. And we can also send a follow-up FAQ on billing. I'm happy to do that.
Yeah, great. And what I understand from talking with it's probably now a year and a half, is that myNurse has been approved by the Center for Medicare and Medicaid Services, CMS. Mm-hmm. And under that, it's a highly, highly regulated healthcare space. And so whatever the fee is that, or the remuneration that myNurse is able to get from CMS, it's just highly regulated based on the calculations and all of the, the actuarials and all of that stuff out of Medicare. So we're working with, Village Movement California is working with a company that is regulated by the federal government and regulated by Medicare. So a known entity. And while I'm talking about Village Movement California and myNurse, there's a question about, do we get money? Is Village Movement California getting paid for the enrollments by Village? And the answer to that is no, and that is actually prohibited by law. We've talked with myNurse about this. We do have a contract with myNurse to provide the kind of communications work we're doing to get the word out to our members, but that is not, it's not a, but we're going to see and whether this benefits our members. What we have noticed, particularly with COVID, is a gap in care coordination, and we want to see if this helps with people's feeling healthy and well. Let's see. Once enrolled in the program, is the support provided by a team, or is one person assigned to the member of myNurse?
Yeah, great question. So you'll get a one-on-one visit with your nurse practitioner, and then you'll be assigned one wellness coach. You may have a backup nurse if they're out of office for a vacation or something like that, but we really like to keep that rapport with you and your coach so that you're talking to the same person each time. So absolutely, you'll have a dedicated team member. And we work on an interdisciplinary care team, so we'll have a dietitian. If you're talking to a registered nurse, and let's say you're a new diabetic and you think you would like to talk to a diabetic educator, we can also have you do a consult with a diabetic educator. We have nurse practitioners that act in the background as consults for our care team and oversight, but you'll have that one-on-one, you'll have that phone number for that one specific nurse on the team, or wellness coach.
Explain how you arrange transportation.
Yeah, so it varies on what community you're in. Some communities have, um, a city specific, and what type of transportation you need. If it's needing assistance because you have a wheelchair, or if you're just needing travel to and from an appointment. We have an index of various resources that we can send you to. But essentially, it would be us looking at that up for you, contacting them on your behalf, making sure that we're arranging that for you, so that you're not having to spend all this time on your own kind of Googling. We have some resources that we've used before, and we'll also work with the village and their team if there's something in particular that lines up well, where we can have the village folks and volunteers help.
Great. I'm moving to some other questions. The charges. What is the role of a village relative to the myNurse.ai service? I would say one of the things is that we're bringing this service to our village communities because we think it's a good idea and it's worth trying. I think that in the conversations over the last year and a half, we've really found a lot of common ground between the values and the vision and the mission of Village Movement California and villages, and then myNurse. So making health human, making sure that older adults have what they need related to healthcare in terms of information, support, education, access, and the very, very, very people-centered practice. So that's one of the things that I would say related to villages. So we're getting the word out and we're supporting those of you who want to get access to myNurse. We all also want to hear how it's going. I mean, if they're promising things that you're not getting, we want to know. This is a project. So this is the learning process. And we're all going in it with eyes wide open and want to hear very specific feedback. I don't know what you would add, Jessa.
Yeah, I think that's absolutely what I would say as well. This is a collaboration, and as a director of our programs, I also want feedback. What is working? What didn't work for you? If you decide this isn't a good program, we're really eager to hear how we can improve and make this something that is of value to our members. So along the way, we may ask you surveys, but in partnership with Charlotte and the villages, we will be routinely checking in to see the value add here, and we hope that this is something that really is helpful, and we're eager to have you.
So here's the question: do you have regular certification requirements?
Certification in regards to the coaches, or?
I'm taking this as, your own certification of staff, meeting the requirements of the CMS.
Sure. Yep. Yeah, absolutely. So we regularly audit our programs, and we follow all of the CMS criteria. In some of the slides here, it got a little wordy and I kind of glazed over it, but there are very, very specific requirements for us to be able to bill Medicare. We have to be, very tight with how we run our operations and our business. And that means things like we're not able to charge unless we have 16 specific days of data sent in that we are actually billing for the 20 minutes. It's not like some of these companies that say they have engagement and they leave a message. We actually have to have documentation that we've met the 20-minute mark with our phone calls or interactions with patients, that we follow all of the HIPAA regulations and making sure that our files are secure and we're following those data requirements. So as far as certification, I'm not sure if there's anything in particular you're looking for, but also to call out that all of our wellness coaches are licensed or certified. These aren't just a nice warm body or a nice person. These are people with credentials that have gone to school and are actually trained to do coaching and care management. And we have licensed nurse practitioners and a medical director overseeing the clinical staff as well.
Great. Here's a question. How long has myNurse been in existence?
Mm-hmm.
Can you tell us about how satisfied current members are and how do you gather that information?
So we've been around for about 2 years live, and we do a survey about every quarter where we ask members a simple question such as, on a scale of 1 to 5, 1 being not good and 5 being excellent, where would you rate your experience with myNurse? And we had 93% rating very good or better. And that's great. That's what we want to see. As a program director and even as a nurse, I want to make sure that if there are detractors, that we're looking into those. I do routine call audits. We also make sure that members are giving us feedback. So we'll do focus groups. If we're designing a new part of our mobile app, we may bring those folks in to say, how can we make this more usable for you? But certainly satisfaction is really, really important. This is part of changing this idea of healthcare being frustrating and confusing to being effortless. You should feel as excited about this as you do opening your iPhone or some other product that you may have at home that is a delightful experience. Healthcare shouldn't feel this challenging. So we welcome feedback and we really look to folks to give us anecdotes along the way. We send emails and encouragement, and we often get members who will respond back saying, thank you, I really appreciate the added support. And on the website, you can see member stories, and we have also regularly scheduled webinars like this and educational materials, blog posts where you can also engage a bit more. And we hope to make this a really interactive and, again, a good experience.
Great. So we've asked Nori to put up the slide so you can look at the website address and the phone number. How many patients do you have now in California?
We have over, I want to say, between 700 and 800 patients so far.
Great. There's a question here. Oh, general question then specific. Are there other similar services out there, competitors? I would.
That's a good question. There are a lot of what we call RPM, or remote patient monitoring services. These typically are just the services. Well, you'll send the data, but you don't necessarily have somebody that's calling you regularly or really working with your doctor. It's kind of an automated report to your doctor. Care management is nothing new. This is something that's been around for a long time, but I think what makes our program really unique is that we blend this personal human approach, addressing not only the medical with the psychosocial and partnering with companies like the Village or organizations like the Village to really give you more than just this checkbox okay, I checked your blood pressure and I'm going to send that to the doctor. That's what sets us apart. We also have on our side, the nurses are really armed with a program that gives them insight into more than just a long, I don't know if any of you have ever had a care manager or a coach before, but sometimes they can ask these really long questionnaires that the company has just kind of made cookie cutter for everybody. Like, tell me about your appendectomy in 1970. It's not really relevant for my call today. So I think that sets us apart from what's out there. But certainly care management and remote patient monitoring are standards that CMS does reimburse for. But I think we have something that we're doing a bit special with how we're designing the program.
Yeah, in scanning the fields, the healthcare team and I saw that there are a lot of these remote patient monitoring programs and companies, and they're coming online all the time. Mm-hmm. But what is missing is the touch. And in my career over the years, when I've looked at technology and touch, what I know to be true is that technology alone without the touch is really not going to bring the results that people want, no matter what sector you're in. So this is a very high touch program. And I believe you're the only group at this point working solely with older adults. There are other coaching programs that have a wider range of ages of people who are being served. So here's the specific question. What if your chronic condition does not involve physical monitoring devices? So like depression or osteoporosis.
Yeah, that's just fine.
How can you fulfill the 16-day requirement?
Yeah, let me clarify. So if you have 2 or more conditions, it can be any of those conditions. It can be osteoporosis, back pain, these types of things. Those conditions don't require a device. Only those that match up with the remote monitoring have to do the 16 days. So if you have osteoporosis, then I forget what depression, you can still participate in coaching. You just wouldn't have a device that is sent out to you for those conditions. So the 2 programs are the chronic coaching and then RPM, and you can be in both or just one.
Great.
Great question.
There's a question here about why our HMO is not included. Do you have an answer for that, Jessa? I have a partial answer for that.
I'll let you take a stab at the billing step. To be honest, I would defer.
Yeah, what I understand from speaking it with and working with Waleed is that the first step was to get the approval from CMS, which is the Medicare and Medicaid program at the federal government level for traditional Medicare, and that you do have applications in for Medicare Advantage. Medicare Advantage is the Medicare HMO, and there are a lot of different Medicare Advantage plans. So that you have the Kaiser Medicare Advantage plan. Kaiser does its own thing. They will always be doing their own thing and are likely not to ever come on board with this, but the other Medicare Advantage plans, I think that there are applications outstanding. Waleed isn't here to speak to that at this point, but I think we're really hoping that the coverage will expand. What we know is that about 60% of older adults in California do have traditional Medicare. Mm-hmm. Other 40% have the HMO. So that's a partial answer to that question. There's a question about our relationship. Who would be doing the marketing of myNurse within a village, each village or VMC? That's a really good question. It's something that we're figuring out through the pilot program. The way it's working right now is that we've identified in each village a point person. So Roberta has been our point person for Ashby Village, and we had a different point person in Slow Village, and we'll be identifying someone in San Francisco Village. And in doing that, we've developed some standard materials. We've developed a newsletter article, we've developed a flyer, we've developed some generic materials that Village Movement California can offer that point person to then distribute within the village. And I'm not, and that's the extent of it at this point. There's no requirement in our agreement and in this pilot program that we're going to do anything other than have this kind of workshop and make the information available, and then help village members. If there's a village member who's signed up or wants to sign up and is having trouble, then the designated person will help with that. But we're basically trying to bring the village community, whether it's members, volunteers, or other community members, together directly with myNurse and kind of hand that whole thing off. So that's how it's working now. And part of the pilot program is to see, what works and what role do we need to take. But Village Movement California is really trying to take the bulk of the marketing responsibility.
Thanks, Charlotte.
Yeah. So I'm looking through the questions to see if there's anything we've missed. This pilot program is going to go through the end of this calendar year with Slow Village, Ashby Village, San Francisco Village, and San Clemente Village. And then I think we'll evaluate and see how that went and see how we might offer it to more, was this of value? Did this work for Village Movement California? Did it work for the village members and volunteers? What was myNurse's experience? And then we'll see where we go from there. So we'll keep you posted. So I think we've gotten most of the questions. I'm going to just ask if there's anything more that people want to know. I'm just doing one last check to make.
One thing I didn't share that I think is really important, and maybe I shared it, but I want to highlight again, is one of the outcomes that we've seen. We will be doing a clinical study in the future to really look at how effective our program is from a clinical perspective. So how are we seeing dips in blood pressure after our coaching, that kind of stuff. And I do want to share something that I'm quite proud of, is that we have seen for members who have high blood pressure, when they're engaged in our program, they've seen a reduction of their blood pressure by 12 millimeters of mercury. So that means, if you had a blood pressure of 132, you dip down to 120. And that's really incredible without adding additional medications. And that's the same type of dip that you would see with an additional pharmaceutical intervention. So just a highlight there that I don't think I touched on is that we are seeing meaningful engagement on our program and satisfaction, but also clinical outcomes that are different and are based on behavior change that you don't typically see from just going to a doctor's visit and going home and taking your meds. So we're really proud of that, and I'm happy to provide more info if folks are interested. Oh, Charlotte.
There was a question and Andrea answered it. Can we share information about myNurse to others who are not village members? Absolutely. If you can remind them to tell myNurse that they heard about it through the village, that would help us understand how well the work we're doing together is going. But if they don't do that, that's fine. We just want people to get the services that they need to achieve optimal health and wellness.
And if you know somebody in the program and you're excited to share this with a family or friend, mention that to the person to mention when they enroll. We do have a special referral program. We want to give thanks to people. So as a little thank you, you may get something special, but make note of that so that if you refer your friend, tell them to mention your name if you're comfortable with that, so that we can send a thank you and make sure that's noted in the system.
Great. And Andrew did remind us the benefit of signing up as a village member is that the village will follow up with you if there are any problems or questions.
Absolutely.
I know it's loud. Let me just shut. Okay. Well, it looks like we have covered a lot of territory. Thank you, the myNurse team. Thank you, Andra. Is there anything more that you would like to say, Andra, in closing? No? Okay, thumbs up. We'll get the recording out, and we'll be very interested to hear how things go with those of you who choose to take the next step, which might just be calling or going on the website to just learn more.
Yeah.
If anyone has any questions at Ashby Village in particular, then they should contact member support, Roberta, or contact the office and say you want to follow up on the myNurse presentation.